Do you have chronic back pain? Have you been told it's caused by a bulging or slipped disc? Let's learn a little about the spine and whether bulging discs may or may not cause back pain. The spine or vertebral column includes 33 vertebrae or bones. There are 5 regions of the vertebral column: cervical in the neck, thoracic in the upper back, lumbar in the lower back, and sacral and coccygeal around the pelvis. In between adjacent vertebrae is an intervertebral disc made up of cartilage that provides cushioning between the vertebrae. Many patients with low back pain receive a CAT scan or MRI of the spine and are told they have disc degeneration or a bulging or herniated disc, believing this to be the cause of their pain. The usual explanation for why the damaged disc causes pain is that it is compressing a nearby spinal nerve. However, there are several problems with this explanation. CAT scans or MRI scans rarely show that a bulging or herniated disc is actually compressing a spinal nerve. Instead, this is often assumed because there is disc disease and the patient is having pain. But a mildly or even moderately protruding disc may not be compressing any nerve at all. So if a patient's disc at L4, L5 is really compressing the spinal nerve, we would expect the patient to have weakness in the muscles elevating the foot and toes, as well as pain in very specific regions of the back and legs. Often, however, patients who have an L4, L5 disc bulge have no weakness, or they have weakness in multiple muscles, or they have pain in large areas of the back that anatomically could not be caused by compression of only one spinal nerve. Now, I'm not for self-diagnosis, but you can very easily Google spinal nerve levels and find where the pain should be with compression of a nerve at each of the 31 spinal levels. And finally, a vast number of research studies dating back to the early 1990s show that disc degeneration, bulging discs, and other disc problems are present in many people without chronic back pain. Disc disease increases with increasing age. In fact, 93% of 70-year-olds have at least some disc degeneration. So disc disease is a natural consequence of aging, like graying hair or wrinkles, and not a cause of chronic pain. So if it's not a disc problem, what is causing your chronic back pain? Let's just say you should check out my video on chronic back pain and the brain. Thank you so much for watching. If you enjoyed this video, please give it a like and consider subscribing to my channel.